Hello everyone, I am Jerice Lee and we're going to discuss suicide rates in young girls, which is a major public health concern. So diving right into our presentation, we'll see that suicide rates increase overall among both sex, men and women. Men at 17.8% in 1999 and ending up with a 20.7 by 2014. And women lower, about 4.0, but increasing by 5.8 in 2014. In this presentation, I'll mostly focus on female suicide rates, which we'll see that had an overall increase. We'll see that the ages of 45 to 64 had a major increase, but one of the age groups that we saw grow a little quicker, though it's the smallest age group, was ages 10 to 14, and they had a major increase at 200%. And I'd like to focus on this population. And methods for suicide vary between men and women, but in particular for women, the suicide method used mostly was poisoning at 34.1%, and we see an overall increase between both men and women with suffocation adding as a method. So why did suicide incidents increase in particular? One thought was in the 80s, going into the 1999s and 2000s, was there were new antidepressants that were not as effective and had side effects. The other one was economic stagnation, which caused a lot of people to be depressed, to go on drugs, and then therefore for OD for drugs. Another reason was lack of insurance coverage. If you didn't have insurance coverage, well, then you couldn't see the doctor and get the proper medications. Also, for some reason, physicians were reluctant to provide antidepressants, especially to youth, that they very well knew had mental challenges. And then also a very major one, specifically focusing on young adolescent girls, was puberty. There is not enough research to confirm it, but there is a hypothesis that is being observed where puberty could be a cause, and it's being researched further, but just basically these young ladies going through a big change in their life and how that can throw a little bit of a chemical balance off and then cause depressive orders and attempts and suicidal thoughts. So let's apply the socio-ecological model to the suicide prevention. And we'll go through it level by level and then place it all together in one so you can see how it looks in the model frame. So at the individual level, some things that we would need to help influence the individual is strategies to resolve the issues to reduce stress. Anything that would hinder this would probably be low self-esteem, which is what a lot of these young ladies face, and that's due to different barriers in their lives, and that can vary. At the interpersonal level, we'll definitely need that family and peer counseling support. Something that could hinder that is a lot of times some of these youth have gone through parental transition. For example, there could have been a divorce in the home. There even could have been a death at home, which can cause depressive orders if they're not having some type of counseling to combat these feelings. Also, we have the organizational level. What would help is medication to help control the mental illnesses. As I stated before, the antidepressants were not as effective. And then, of course, what would hinder that is lack of insurance. Well, if you don't have insurance, you cannot obtain the appropriate medication. At a community level, we want to implement, of course, school-based interventions. What could cause hindrances at a community level is when the person is surrounded by poverty and a lot of things that are depressive, that creates a depressive environment. And then, of course, policy. Policy is extremely important. And what would be helpful is training for teachers, law enforcement members, and school counselors. What would hinder this is minimal restrictions on firearms. So we definitely need to make sure that there are increased policies as it regards to firearms. And this is what the socio-ecological model looks like, but it's all put together and with the different levels intertwining with the topics of influence and the supportive resources. So looking at each intervention that will be applied, the first one is the model adolescent suicide prevention program. It's called MASP. It was originally designed for a Native American group, but can definitely or will definitely be adapted to the situation of the young ladies aged 10 to 14. And so this particular MASP is a best practice model, and it's used to implement community education, and it's going to be used to actually involve the community more in the ownership of creating the program and implementing the program. It also offers formal surveillance of associated suicide behaviors, school-based focus and design curriculum, community education, mental health screenings, and neighborhood events and activities is comprised of this intervention. And of course, you have to evaluate each intervention. And with the MASP, we want to see the intensity of the program. How many times was the program implemented, the times, the hours, the days. And that's going to be recorded by the timesheets that's going to be turned in by the facilitators. Also, we want to see if there was an attitude perception change that took place. And that's going to be measured by a Likert survey of 1 to 5, 5 being the highest, 1 being the lowest. We want to see if there was an increase in knowledge for the material, and that's going to be evaluated by the curriculum pre and post test, where they will take a pre-test to evaluate the knowledge that they knew before the program, and then a post test to evaluate what they knew after each session. And then one of the barriers that we need to look at is participant retention. We want to make sure that each participant follows through the entire program. And so we'll offer incentives. And to combat that barrier, we're going to make sure that we have we're going to offer incentives, and then we're going to measure it by making sure that we have a final participant count. And so the other model is the Preventive Suicide. It's a toolkit for high school students that's going to be implemented. This is the other portion of the intervention. It's going to offer trainings to this population, and the trainings will include how to address and respond to suicide occurrences, also how to integrate different strategies to reduce suicide within the schools, and also how to connect individuals to effective programs and resources. And we're going to evaluate this program by seeing if the teachers were receptive to the training, and we'll measure that by how many number of incidents they report due to the training, and how many were reported previously to the training. We also want to see that the information was accurately applied to the situations by taking a test, and so they'll have to complete a checklist that will be scored. Also, we want to have a certification of completion. And that certification of completion is going to be based off of a pre and post test that will be analyzed to see the increase in knowledge. Also, we want to ensure a barrier that teachers can have is their time. Sometimes they don't have enough time in a day to do things. So we definitely want to make sure that time allocation is there. And in order to do this and to measure this, we're going to make sure that the training takes place before the school year starts. The last intervention is the SOS, which stands for Signs of Suicide Prevention Program. It's actually one of the best practices that was proven by the Georgia Public School System as an effective intervention training. It focuses on middle school students, and we want to make sure to reduce the stigma around depressive orders. We also want to make sure that the information in the format of the intervention will be user-friendly and will be instructed by different activities through DVDs and other enhanced material. This program will be evaluated by seeing how successful were the partnerships, and will facilitate one-on-one key informant interviews and collect a list of the partners and their roles in the intervention. Also, students will have a self-observation testing to identify resources, and we're going to take this by having a group interview with the students, and they're going to fill out a self-reported questionnaire, and we'll score that. And then also, students increase in knowledge and coping mechanisms to deal with depressive orders will be actually observe and analyze as well, and that's going to be conducted through a pre and post test. And one of the barriers that could take place is data collection, and so we want to make sure that there will be a comprehensive data collection design system in place. And so this is my logic model that I created for the intervention called Community Works Suicide Prevention Logic Model. Very, very proud of it. As you'll see, there are the resources and the inputs for the model, activities, the outputs, the outcomes, and impact. The overall impact and goal that we are trying to reach is reduce suicide and suicide attempts among adolescents girls. That's our end result that we want to make sure that we obtain. How we're going to do that, this program will be federally funded by the CDC. I know that that is not on here listed, but it will be federally funded by the CDC. And there's going to be trained expert staff to help implement it, a community center that's going to offer resources, and then we have the school partnerships. Then we have our activities that are going to take place every week with the youth, the teachers, family. There's going to be a graduation, exercise, classes to help reduce stress. I'm going to have a mental health coach and a town hall meeting. And then from all of these activities, we're hoping to provide safe spaces where youth will feel more supportive relationships. Experts will be trained to help reduce these episodes of suicide, family support, recognition of the program completion, strategies for a healthy mind and body, and that's because of the exercising, and also we want to garner community support. And then of course we have our outcomes as a result of our activities and our outputs. So I hope that you have enjoyed this presentation. Thank you so much, and if you have any questions, I am available. Thank you.